Foreign Minister, representatives of the New Zealand and British High Commission, members and senators, Executive Director of Aspen Medical, ladies and gentlemen. It's a very great honour for me to be able to speak on behalf of the team that established Australia's first ever treatment centre in an Ebola hot zone. I believe every member of that team felt very privileged to have been selected to play a part in that mission. Our first 10 clinical staff left Canberra on November the 28th after the extensive training at Aspen Medical. In Sierra Leone, we met up with the Aspen Advance team, who had already established networks with the other agencies and the Sierra Leone government, as well as securing accommodation and transport in Sierra Leone. When we arrived in Sierra Leone, the epidemic was out of control and the number of cases was increasing exponentially. I can say now that it was frightening, and it was not at all obvious at that time that the intervention would work. The international strategy consisted of isolating the sick in designated treatment centres, of which we were one, quarantining the contacts of the sick, and burying the dead in a safe and dignified manner. Our team had been designated to run one of the 6 treatment centres in the greater Freetown area on an abandoned airfield at Hastings. And at that stage, the British Army, who were doing a fantastic job, a fantastic facility, were just completing their work. So it wasn't quite ready when we arrived. But we used that time to travel by convoy to Beautown, where we went to the headquarters of Médecins Sans Frontières, who were at that stage the only group that had any experience in managing Ebola. And from that group, very generously, the doctors and nurses explained some of the techniques they used in managing Ebola in their treatment centres. We then travelled back to Freetown, and where we started to set up the treatment centre the following week as the equipment began to arrive from the United Kingdom. At the same time, we trained the first 150 of the national staff. At that stage, about half of those were nurses and half of those were local support staff. Our experience in running the Hastings Airfield Ebola Treatment Centre was extraordinary, surreal, frightening, but ultimately, I strongly believe, very worthwhile. There is consensus internationally that the multinational, multi-agency response has brought this epidemic under control. And there is little doubt that this has saved many thousands of lives and prevented the spread of this infection to other countries. Not only that, as an infectious diseases physician working in an Australian hospital, I can tell you that bringing this epidemic under control was in Australia's national interest. We know this, and this is clearly demonstrated by the transmission of infection from travellers to healthcare workers, both in Europe and the United States. We had to get this under control for our own interests. The very experienced team that worked in the Ebola Treatment Centre did their work with a very high degree of professionalism. As an infectious diseases physician, I can tell you that infection control practice is one of the key markers of the quality of clinical care. We know that more than 800 healthcare workers have become infected during the current epidemic, of whom 500 have died. And in the 6 treatment centres in the greater Freetown area, doctors and nurses have been infected in 4 of those 6. However, not one staff member at the Hastings Airfield Ebola Treatment Centre became infected with Ebola, either expat or local. Many of us have developed friendships with our colleagues from Sierra Leone, and we do hope that the international community does not abandon them now that the epidemic appears to be coming under control. Some of our team from Hastings can't be with us tonight. They've gone back to Sierra Leone with Aspen Medical and are managing the expat and healthcare professionals clinic in Freetown on behalf of the United Kingdom government. I believe this provides further evidence of our recognised expertise and the fact that we are now well respected internationally in this area. I wish them all good luck. So finally, on behalf of our team, I'd like to thank the governments of Australia, New Zealand, the United Kingdom and Sierra Leone for supporting our work, and also to thank all our friends back in Freetown.